South Africa. And I grew up there until, as a young adult, my husband and I moved to Sydney, Australia, and we lived there for 4 years. We then moved to Vancouver, Canada, and we have been lucky enough to call it home for over 19 years. And so really, for me, experiencing diverse cultures, weather, food, sports, and healthcare systems has really shaped my perspective on life. But today we're going to do a bit of time travel. We are going to go back to 2010, the year the Icelandic volcano caused mayhem with flights over Europe. It was also the year the iPad was born. This was the year that for our family, life changed forever. There was a line drawn in the sand before and after the 18th of May, 2010. Our son was only 4, and it was the year I was diagnosed with a non-malignant brain tumor in the emergency room after the sudden onset of vertigo and migraines. What mattered most to me in that moment was, would I get to see my son grow up, and would I get to grow old with my husband? My treatment plan was what they call watch and wait, meaning that I didn't need surgery. I just would have yearly MRIs to monitor the sort of growth of my tumor. And this was hard, especially as a parent with a life-altering condition. But as John Kabat-Zinn said, he said, you can't stop the waves, but you can learn to surf them. So what mattered to me really was surrounding myself with a strong medical team, second opinions, and really leaning into my family and my friends. And I did this, and I also had to learn to be my body's own advocate, which is sometimes hard in a system which is not intrinsically set up around the patient. And it was 2 years later that my brain tumor doubled in size, which caused my brain to swell. And this was a rather scary experience for me. And at the same time, my local safety net of quality care disappeared. I experienced medical negligence. This was a terrifying experience for me. So at that point in time, what mattered to me was access to care. When I was finally able to get the care that I needed, I remember lying on the cold operating room table just before my brain surgery. I was under those bright lights. The nurses and the people were bustling around me. I had monitors and cuffs being strapped to my body. And the sudden chill of anxiety passed through me. You see, I hadn't felt scared until that point in time because my brain was too swollen to actually even care. So what mattered most to me right then was human connection. A nurse came to me and she draped this warm blanket over me, and she asked me if there was anything that she could do to help me. And I asked her, please, can someone just hold my hand as I go under? Even now, 13 years later, that memory is so strong it powers through my body. And she said to me, of course, she said, I will be there for you. And since that experience, I ask someone to always hold my hand when I go in for surgery, and that has been multiple times because it's that important to me. Now, I want you to imagine all those moments that matter to me as Claire Sneeman, wife, mother, sister, daughter, friend, lover of nature, reader of books, being part of the conversation with my healthcare team each and every time I step into the healthcare system. How might it change our healthcare system for both those receiving care and those providing care if we paused for just one moment to ask that question? What matters to you? What is important to you? How might I help you? My hope for our healthcare system, not only here in BC, but actually across Canada and even further than that, is that we can see and harness the power behind this one simple question. What matters to you? Would we be able to create a culture that sees individuals as people first and not just as individuals with conditions, a disease, or see them as just the individuals treating people? And that what matters to us as individuals is of such value. Would we create a system that sees asking people what matters to them as a real driver of people-centered care, where our healthcare systems are really tailored to people's needs in partnership with them and not just given to them. Would we find that asking what matters to you improves the quality of care and the outcomes for patients? And for those providing care, it really improves the joy in the work that they do each and every day. It retains more staff, and it actually improves partnerships across the organization. What if we let go of the fear of asking people this one simple question, this incredibly powerful question? What if it could impact and improve our system so dramatically? And we just did it, each and every day, starting with just one person. And what if asking what matters to you became the next key indicator of the health of our healthcare systems? Where might we be in the next 5 years? And what might that feel like for those receiving care, those providing care, and our communities? Thank you.